welcome to Proven Cures. Today is Wednesday, October 14th, 2020. And today I want to discuss with you a review study. So, a review study is basically a review of several studies about a particular disorder. In this case, it is autism, also referred to as Autism Spectrum Disorder. The review study looked at several studies done over the past 10 years using a drug that is traditionally a diuretic called bumetanide. And it has been found at a very low dose to be effective in treating the social disorders associated with autism. So, according to this article, let me tell you the name of it for starters, because this is something, if you are a sufferer, an adult sufferer of autism, or you have children who are autistic, or you know of someone, this is a study that you will find useful in also looking up for yourself. So of course I'm going to include the name of it and where it's published in the discussion section of this video, but I'm also going to tell you now. So now is a good time to break out your pens and paper if you still use those things instead of an electronic device or your iPad or what have you, and document the name bumetanide. That is B as in boy, U, M as in Mary, E, T as in Tom, A, N as in Nancy, I, D as in dog, E as in egg, bumetanide. So the title of the study is Bumetanide Therapeutic Effect in Children and Adolescents with Autism Spectrum Disorder, a review study. The researchers are Raheleh Mollajani, Mohamad, Joghataei, 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 and Mehdi Tehrani-doost, Doost. This was published just last year, September 1st, 2019. So this is all new research. So basically, the use of bumetanide for treating social affective disorders in autistic patients is fairly new to the scientific community. That's why this is such a recent publication. Even treating doctors and physicians may not know about it. So if this is something, after I explain the studies and everything that are explained in this review, if this is something that you would like to try, or you would like your child to be placed on, you may actually have to take this study itself to your pediatrician or to your physician, because honestly, they may have never heard of this. It was published September 1st, 2019 in Basic Clinical Neuroscience. That's the name of the journal. Oh, Basic and Clinical Neuroscience. The 10th edition, volume 5, pages 433 to 441. Okay, I'm going to actually turn my camera around so you can see it for yourself. Hopefully it'll focus. Hold on. Hopefully you can see that. I'm holding it for a while so it'll focus. I'm not sure. But like I said, I'm going to put this information in the description section of this video as well. All right. Okie dokie. So the authors explain here that currently there's no definitive cure or proper medication for autism spectrum disorder. There have been 2 drugs that have been prescribed for children in order to reduce the irritability associated with autism. And those drugs are, in fact, hold on one second here, because this is a very long article and I really don't want to waste time on what's not important. Those drugs are risperidone and another one that I think I had a hard time pronouncing. Yeah, risperidone and aripiprazole. You might be more familiar with these than I am. Someone I know has an adult son. He's in his 20s though, who she told me is autistic. And while he has the irritability and anger aspect of the disease under control, she says she worries for him in terms of his social networks, not being able to really maintain friendships very well. Often she said she described him as being antisocial, someone who was more comfortable being alone. And she said he's at the age where she would like to have, to see him form solid relationships with people, and she doesn't see that happening. And she's worried about that. She said it also seems to be getting in the way of him maintaining a 40-hour work week, a regular 9 to 5, because in those situations you have to maintain relationships with people, and also be able to divert your attention and multitask in many areas. And he's not really exhibiting the ability to do so effectively. So she asked me to look up more information for her if I could find something. And I was really disheartened to hear what she had to say, because I was of the belief, like most of the medical community, that there is no treatment for this disorder. It's there's nothing. But I was wrong in my thoughts, and I'm glad I was wrong, and I'm hopeful in sharing this data, and I hope that this information is helpful to whomever gets to hear it. So yes, the intervention is called Bumetanide. If you are part of the medical community, you may have already heard of Bumetanide, because Bumetanide is traditionally a diuretic. It is something that makes you go to the bathroom to urinate, and is usually prescribed for hypertension, high blood pressure, various heart conditions and stuff like that. So the researchers here sought to understand. What they did was they read up about a lot of different studies that have taken place since 2010 up until now on the use of Bumetanide for the treatment of autism. And they wanted to see why it worked. And what they found was that the social affective disorder aspect of autism is indeed caused by a large amount of chloride ions in the cortical neuron. And the cortical neurons are in the cerebral cortex of the brain. The four main lobes of the brain that the chloride could be found in are the frontal lobe, the parietal lobe, temporal lobe, and occipital lobe. And Bumetanide, in fact, is able to reduce the chloride. What does it say here? Exactly, this is what the findings revealed, that cortical neurons have high chloride ion and excitatory actions of GABA. GABA is a short term for gamma aminobutyric acid. And this was initially found in animal models, preclinical studies. And based on the findings with the animal models, that is what caused, that's what spurred future research in human beings to see if Bumetanide would be useful for treating autism in persons. And in fact, there's an entire table here. I'm going to skip over the animal studies and jump right into the human studies to let you know how effective it was found to be. So the first study charted here was in 2010. The researchers are Lemonnier and Ben Ari. They did a pilot study in 5 neonates, brand new babies, just born babies, who were found to be autistic. And those babies were given 1 milligram a day or half a milligram twice a day, which amounts to 1 milligram per day for 3 months. And the end result was that Bumetanide improved the behavioral aspects of these babies who were found to be autistic. The second clinical trial they reviewed in human beings was also conducted by Lemonnier and other researchers in 2012, and it was done in 60 children with autism or Asperger's syndrome between the ages of 3 to 11 years of age. So this is an older group, and they were split into two groups, some receiving placebo and others receiving the bumetanide at 1 milligram per day, also again for 3 months. And in that case, and I want to be specific here, give me 1 second, please. I'm flipping between two screens so I can be as thorough as possible, but it makes me a little bit slow. So just hold on, just bear with me for a second, because these older children from ages 3 to 11 were administered certain tests for autism. Those tests include something called CARS, which is the Childhood Autism Rating Scale, ABC, which is Aberrant Behavior Checklist. They were given the CGI, which is the Clinical Global Impressions, which stands for Clinical Global Impressions Test. RB, which is Repetitive and Restrictive Behavior Test. And RDEG, which stands for Regulation Disorder Evaluation Grid. Okay. And the bumetanide was found to significantly reduce values on the CARS, the CGI, and ADOS. Did I even review what ADOS is? Do I see ADOS? Yes, I'm sorry. ADOS stands for Autism Diagnostic Observation Schedule. So all of those values went down. The side effects that they saw was mild hypokalemia. And that's to be expected because bumetanide is a diuretic, and the main side effect of taking a diuretic on a regular basis is the reduction of potassium levels in the blood. So should you go to your doctor and you get a prescription for this bumetanide, you may also get a co-prescription for potassium. For sure, they might tell you to come in and have lab tests done after you've been on the bumetanide for some time, just to make sure your potassium levels are normal. Okay, it was also found that bumetanide improved the symptoms of autism spectrum disorder and was viewed at the end of that study as being a promising novel therapeutic agent to treat autism. The following year of 2013, another researcher by the name of Haji Khani and researchers tested bumetanide in 7 high-functioning males with autism spectrum disorder. This was another open trial pilot study. They were given 1 milligram of the bumetanide per day for 10 months instead of the 3 months. And what was found was an improvement of emotional face recognition and activation of brain regions were involved. Areas included rewards, motivations, and emotions also showed an increase in activity. The following, that's just a case report. That's just one person. Here we are in 2015, another set of researchers. And if you want to look for these trials that I'm talking about now, they are explained within the body of the review study that I'm going to put in the discussion section, and they're also part of the bibliography, so you can look them up individually yourself if you so choose. So this do et al means and people and researchers. So DU and other researchers in 2015 tested bumetanide. Did I say that correctly? Bumetanide in another pilot study, this time with 60 children with autism. And they were given bumetanide 0.5 milligram twice per day, along with something called ABA training, which sounds like behavioral therapy, for 3 months. The total scores it was found that their total scores on the ABC test, CARS, and SI were reduced in both groups. The overall scores of ABC and CGI in the combined treatment category, those who received the bumetanide and the behavioral therapy, were significantly reduced in comparison to those who only received the bumetanide. No undesirable side effects were found. Then the most recent study was once again conducted by Lemonnier and his or her colleagues in 2017. And that time they conducted a double-blind randomized placebo-controlled multi-site dose-ranging study that enrolled 88 patients between the ages of 2 to 18 years of age who had autism. And in this one, they tested doses of the bumetanide to see what side effects, would occur as a result. So one group was given 0.5 milligram of the bumetanide twice per day, which was the standard up until this study, the standard testing amount up until the study. Another group was given 1 milligram twice per day, and the other was given 2 milligrams twice per day. And this was done for 3 months. And the most common adverse effects were hypokalemia, which is once again a reduction of potassium, increased urine elimination, which is what diuretics do. That's to be expected. Loss of appetite, dehydration, which can occur if you're not drinking enough water, and asthenia, which is basic weakness. The prevalence and incidence of adverse effects, however, were directly correlated with the dose of bumetanide. Notice that in the earlier trials in which they were only given 0.5 milligram twice per day, the only side effect reported was the reduction in potassium. So at the end of this study, researchers surmised that bumetanide made better the core symptoms of autism and exhibited a favorable beneficial to detriment ratio, especially at 1 milligram twice per day. These are clinical trials. So if you are to take this study to your physician or pediatrician or what have you and ask to try it out, note that your doctor more than likely will be more comfortable starting you out at the lowest dose to see how well you do. And of course, these are lifestyle changes that are expected to be affected. And so I guess the best way to test for lifestyle changes would be in the administration of some of those tests, or basically asking questions about your functional roles in life, and have you noticed any changes with how you deal with people, or have your child's interests broadened, maybe have become less restrictive, less repetitive, things like that. That is what is expected from taking bumetanide. I keep wanting to say something else, and I don't want to do that. So I went over the studies that they reviewed, and I'm sure there's something else I want to share with you here. No, I went over that one already. Bumetanide. Okay. So the last thing I want to touch on before I end this video is that there are some other side effects that are to be expected from taking a diuretic, and I'm going to say all of them, because I don't want to hide anything or give you a false hope or a false idea of what to expect from taking this drug, or if your child takes this drug. Okay, like I said, it's a diuretic. It's something that can be clinically managed by taking a potassium supplement, starting at the lowest dose to see how well you do, and hydrating often, drinking a lot of water so that you do not get dehydrated and get sick and get weak. So hypokalemia, which I think this may be the third time I'm explaining, this is the reduction in potassium. Hypochloremia, the reduction in chloride, which is what we want it to do. hypochloremic metabolic alkalosis, and hyperuricemia without the gastroesophageal arthritis. Hyperuricemia is abnormally high levels of uric acid in the blood. So these are the things they're probably your doctor will check for before and during prescribing the bumetanide. Mind you also that these studies ran for 3 to 10 months. Nothing was done longer than 10 months. So I really don't know how long you would have to be on this to see a permanent change. That is something that would have to be tracked between you and your physician or pediatrician. In closing, I'll read the concluding paragraph, but basically I've shared everything that I can share that will be helpful for you. But it says in conclusion that autism spectrum disorder is known as a neurodevelopmental disorder characterized by an obvious excitatory inhibitory imbalance in selective neuronal circuits in the brain and the cerebral cortex, particularly in the GABAergic signaling. Likewise, numerous studies have indicated that drugs that affect the GABAergic synapses in the brain can ameliorate behavioral defects in both animal models and human beings who have been diagnosed with autism. Experimental works and clinical observations have further shown that bumetanide is a safe loop diuretic. Without serious adverse events. And that's the end. So hopefully you find this helpful. I'm going to upload this shortly. Please like, share, subscribe. Once again, this affects children. So please share, and leave comments. Let me know what you think. And if you feel like you don't need to subscribe because this is just a one-trick pony, this channel is dedicated to finding treatments and possible cures for conditions that are presumed to be incurable, for conditions that are presumed to cause permanent disability, this and morbid fatalities, things like that. I'm constantly finding new information, sometimes even about the same topic. So, and the information is always groundbreaking, and it's helped so many people. So I encourage you to subscribe, not just for yourself, but for people in your life, and also to look forward to new information coming down the pipeline that you may have never heard of before, that you never know when it may become useful. That is why I encourage you to subscribe, okay? And like I said, leave your comments, and thanks for watching. Until next time, bye-bye.